Next month is National Stroke Awareness Month, but we didn't want to wait another minute here to share findings from a study recently released by the Journal of the American Medical Association. We've all heard taking an aspirin a day can help reduce your risk of certain types of stroke and heart attacks if you're over age 50, right? But now researchers say it could actually result in major bleeding. Uh-oh, now what do we do, right? Dr. Amit Deshmukh, a board-certified ER physician at Overland Park Regional Medical Center, here with us once again to help us kind of sort through these findings. This goes against everything we've heard for how long? Forever.
Many, many years.
Many years. So what do we do now? Or what did the study tell you?
The study showed basically that several individuals that were at risk or were not at risk for having any heart disease were taking an aspirin a day. It did lead to some risk reduction, about 11% in heart attacks and strokes, but the problem was it led to an increased incidence in major bleeding. So aspirin works as a blood thinner. It decreases your platelets, makes your blood flow a little smoother. Problem with that is it can help prevent strokes and heart attacks, but that can make you bleed also from like an ulcer or other
you're not talking
events.
From like a big cut or something. You're talking internal bleeding.
Usually internal bleeding. Those are major bleeding events.
Okay. So break this down to us in simpler terms. What should we take away from this finding?
I think in general, first of all, the take-home message from this study is definitely don't just stop your aspirin, because we don't want patients to go out and just see the study and just stop taking aspirin immediately without consulting with their physician.
Okay, good to know. Because we've been told for years, just do those little chewable ones, right? Those little baby aspirin.
81 milligram baby aspirins, yes.
It even has the heart on the bottle.
Yes, so that is the whole premise, I think, of this study. The study is basically done to see if there's some validity to that or if there's a risk associated with that. And I think that's what the finding of the study was, is that although you do help prevent some heart attacks and strokes, you do have to look at the other side of the coin where you see that there is a risk of bleeding from taking the aspirin.
Okay, so you say don't stop if you've done this
Definitely
as a routine.
Don't stop.
But what do we do with this information?
I think you need to at least be aware that there is a bleeding risk and consult with your physician. So if you're taking an 81 milligram aspirin a day or any aspirin a day and you don't have major cardiovascular risk or stroke or anything like that, then you may want to talk to your doctor and say, hey, do I need to be taking this or am I at a risk of increased bleeding? Definitely don't stop on your own. There's other lifestyle modifications that can be done, like stopping smoking, weight reduction, watching your cholesterol, controlling your blood pressure, other things that kind of need to be done in conjunction with the stopping or starting of an aspirin therapy.
Okay, good to know. Have the conversation.
Definitely,
right?
Definitely.
In light of a stroke month coming up, it's a great time to talk about it with your family and everyone else. Thank you,
For sure. Thank you.
Thank you so much for stopping by once again. For more from HCA Midwest Health, you can go to kctv5.com/HCA Midwest.